last 24 hours, a story has emerged from India's heartland and spread across the world, which didn't tell the new India story, but the one which fits into the image of the dark underbelly thriving in small towns. Remember the urban legend of feeling a prick in the public place only to be told that you've been HIV infected? Well, that's more or less what happened to people in Unnao, Uttar Pradesh, where a whole bunch of citizens have just become aware of their HIV status. And all because of getting an injection at a regular clinic that they go to. This barely comes after just days after Finance Minister spoke about the government push for one of the biggest healthcare schemes in the world, as if mocking our desire to be world-class when we can't guarantee even a clean syringe. Because what else can explain the heart-wrenching tale of the lack of healthcare in India and its life-altering implications that have surfaced in Uttar Pradesh? Here's the story. 33 people, one of them as young as 13, have been infected with HIV by a quack. That's a pretend doctor for anyone who doesn't know that. And why and how? Because he was using just one syringe to give an injection to all these people. NDTV's correspondent Alok Pandey traveled to Bangarmau, tehsil in Unnao, and spoke to those victims who are now completely at a loss, and their families at a loss. How do they treat this? How do they go about it? What are the medicines? Nobody's even sure what kind of medicines are required. Now, here's how it unfolded. All the victims had been treated by this quack, the same sort of doctor. They all had the same tehsil. They'd been seen over 13 HIV cases, which were detected actually in a government health camp in November 2017. This is very important. So, a first batch of people were detected as early as November. At least the number of people that we know of right now is 46. Why? The question that we're asking is, why wasn't any serious government intervention done when the first batch of cases were found in November? Because the latest have been found from the camp which was held around Republic Day, 24th, 25th, 27th of Jan. That's the second health camp which revealed 33 new cases. So in total, 46 cases have come out from Unnao. What do the people of that area say? They say that this could just be the tip of the iceberg.
आबादी है 1200।
और कितने लोगों की स्क्रीनिंग हुई है अभी तक?
स्क्रीनिंग 196 की।
196 की।
हाँ, इसमें 24-25 लोग निकले हैं।
कभी आप लोग को ऐसा शक नहीं हुआ कि ऐसा कुछ कर रहे हैं कि 10 लोगों को एक ही सुई लगा रहे हैं, ऐसा कर रहे हैं?
हाँ, ऐसा तो करता ही था।
तो आप लोग को ये मालूम नहीं था कि ये मतलब
ये पहले से जानकारी नहीं हुई है। पहले कई लोग खत्म हो गए। ये जानकारी हमारे चाचा जी खत्म हुए हैं, इनकी हमने टेस्ट कराया है।
So imagine their plight, just finding this out, being given those slips. Usually the protocol is when someone tells you your HIV status, you have to have counseling. That's how it's done internationally. Here, they just go for a regular health camp and learn of this. A stunned government has ordered a probe and arrested the quack, but the question remains, what about those infected with this disease? Tonight on Reality Check, we discuss with experts the implications of this Unnao HIV horror, and can we even think of universal health coverage when quacks so easily fill the glaring voids in our healthcare system? That's what we are going to talk about. But first, Alok Pandey's story from Bangarmau, where this horror has come alive.
Chak Mirapur village, population 1300. The epicenter of the HIV horror in UP's Unnao district, where 33 people in 3 villages have been infected because the quack they went to injected them with the same syringe. In this village alone, 13 people have been infected with HIV.
this young boy here, about 10 to 12 years old, probably 13 years old according to this slip here, he has also tested positive for HIV. You can see this slip here that was given to him at the counseling center. He's just 13. There are many others in his village who we have met who've also tested positive. ये बताओ छोटू, तुम कब गए रहे उस डॉक्टर के पास, कब गए थे?
1 साल हुआ है।
तो तुमको कोई इंजेक्शन लगाया गया था?
हाँ, इंजेक्शन लगाया था, दवा भी दी थी, 3 खुराक।
दवा भी दी थी। और तुम्हारे बाबूजी को भी लगाया था?
हाँ।
This 20-year-old college student, another victim of the fake doctor.
ये बताओ कि तुम वो जो डॉक्टर थे झोला छाप, कब गए थे उनके पास, क्या हुआ था?
1 साल पहले गए थे उनके पास, 2-3 बार गए थे, बस इतने में हो गया वो।
और तुमको कोई इंजेक्शन भी लगा था?
हाँ, इंजेक्शन लगा था हमको।
इंजेक्शन लगा था?
एक ही नेडल से लगाते थे, कई लोग नस में लगाते थे वो।
नहीं, तो उस वक्त तुमको कोई इसकी जानकारी थी?
नहीं, जानकारी नहीं थी। जानकारी होती तो क्यों जाता मैं।
This 30-bedded government rural hospital is just a few kilometers away. So why were all these people going to a quack in the first place?
ये सर 10 रुपए में दवा देते थे, इंजेक्शन लगाओ थे सर। सरकारी स्कूल में लाइन लगाओ खो तो डॉक्टर सुनन नहीं थे, वहाँ दवा लिख दें। 250 की दवा बैठे थे, कमीशन लेते हुए डॉक्टर साहब यहाँ, यही लिए यहाँ 10 रुपए में 1000 रहे सर।
This hospital that caters to a 2.25 lakh population has just 9 doctors. But none of them are specialists. The doctor in charge here admits to a shortage of specialized medicines and to inertia in dealing with quacks.
इसके लिए टीम बननी होती है, उस टीम के साथ बीच-बीच में इन लोगों का चेक किया जाता है और कार्रवाई की जाती है।
Could you give us any statistics कि पिछले साल में have you busted any quack, any number of quacks in this area, sir?
No.
According to 2017 data from UNAIDS, new HIV infections in the country have decreased by 46% since 2010. But horror stories like Unnao continue to pose a big challenge. With Gaurav Sharma in Unnao and Alok Pandey, this is Rohit Wellington for NDTV.
So the horror story that has happened for 46 people, and how some of these victims are as young as 13, and just what lies ahead for them. Also, as our story pointed out, HIV infection numbers are down, and yet these cases are taking place even now. Let me just introduce our guests this evening. We have the President of the AIDS Society of India, that's Dr. I.S. Gilada. We also have in studio Poonam Uthreja, who is the Executive Director of Population Fund of India. We have Vandana Singh, the spokesperson of the Samajwadi Party. From the BJP, we are hoping to be joined by Ijaz Ilmi. And we have Dr. Pavitra Mohan, who works in primary and rural healthcare, who joins us from Udaipur as well. If I can start with you, Dr. Gilada, this story, does it surprise you at all? It is shocking for us. It's become an international headline. It's being tracked by all international agencies as the kind of freak accident, freak and horrific incident that's taken place, that somebody was doing this and he's infected so many people over the course of a year. The question that we want to ask here on Reality Check is, when the first bunch of people were detected in November in the health camp that took place, why is it that all our radars didn't go up then? Why is it that the person who, the quack, wasn't arrested in November? Why is the police acting now?
Actually, in government, there is a system of some kind of a knee-jerkism. Whenever such big thing comes, then they will come in big action. They will talk against quacks, but quackery is going on for ages. I have been working in the field of HIV for last 32 years, and I have seen many such scandals happening. And life in India has been very cheap. People
there are many such. Sorry, I have to. You said something very shocking. So I wanted to interrupt.
I can. Yeah, there are many such horror stories. There have been such stories from infection from blood banks, infection from blood, where some of the HIV positive blood has been issued from the blood banks, but nothing has been done. Only at that particular time they talk about it and then they forget about it. There is something deeper to the story, because if we talk about mere percentage of getting HIV from needle prick, it is very low. It's like 0.1 to 0.3%, that is 3 in 1,000. So if there are 37% or 46 people are infected, then there could be about 10,000 or 12,000 pricks that has happened with the HIV infected needle. So there is something really great, more than what is being seen. Secondly, we are talking only about HIV, but there are infections which are more common than HIV, which are easily transmitted. Hepatitis B, 100 times more possible than HIV. Hepatitis C, 10 times more possible than HIV. So if you do a reality check in those villages for all the infections like hepatitis B, hepatitis C, syphilis, you will find so many infections.
Dr. Gilada,
and that
is there, because we couldn't find those figures, but is there any figure that you have, because you're saying it's so common of, you know, blood bank, this kind of accident because of negligence, people getting infected, is there any figure for that, sir?
No, I'm giving, it's not happening all around the year, but there are accidents or there are incidents happening, and there have been, if you just Google around and you find that how many such stories have come about blood banks, that despite having blood checks, despite having all kind of quality checks in place, so many people were infected. And if you go at some other countries, how they have been stringent in acting. There are two incidences I can give you in 85 and 85 October in Germany, where 13 people were infected and health minister had to resign. Why? Because it was 2 months delay of checking for HIV when the commercially available tests were available, and parliament took 2 months time. In France in July 85, the delay was by 2 months because the scientific evidence was there, but the commercial test was available after 2 months, and the health minister was prisoned after 16 years in 1999. So basically such kind of instances are there, but in India nothing happens. Everything goes scot free.
No, that's a really good point you make, Dr. Gilada, and I just want to point out that one, I remember as a health reporter, this is years ago, reporting on a case of this young boy who was less than 10 years old, and he had been in AIMS getting treatment for leukemia, and as his cancer went into remission, he found out that because of a blood bank, that's what you were talking about, because of a blood bank, he had been infected with HIV. So imagine the horror, and that's what we're seeing in this village, where they have no idea what HIV is, and of course there's the other question of social stigma. I don't know who's talking to them about the stigma and how to cope with that. Before I just do that, I just want to go across, just to get a rural, you know, how the healthcare works in the rural system. I just want to go across to Dr. Pavitra Mohan. One of the things that we've been speaking to people that they say is that perhaps the increase, the huge number that we're seeing, 46 people infected, Dr. Mohan, is it true that it also happens because people feel reassured when they go to the doctor and they want an injection? So is that one of the factors which perhaps led to this one quack infecting so many people?
So I would say it's partially correct. There is a demand for injections by the community, but if you look back, this demand has been induced by doctors themselves. And why these informal providers are making good money by giving injections and treating it cheap is because of the dysfunctional primary healthcare system. If you see, there is a clear evidence that wherever there is a strong public health system, the quacks aren't there, and the demand for injections also reduces. So on one hand, there is an increase.
I just, can you explain to me, what does it mean? Like what is a strong system where quacks aren't there? What do you need for it to be like that?
Which basically means that families are able to access a primary health center which is close by. When they fall ill, they are detected early, where there is a doctor or a paramedic available who listens to them and is able to treat them. It's well stocked with drugs, etc. And this is no rocket science. This is just basics, that when you fall ill, you need somebody who is close by, who talks to you with empathy, has the drugs to provide to you, and doesn't rob you of the money that you have. So that's I'm not asking for much, but in absence of that, the informal provider quacks like this one flourish, and with the consequences that we are seeing now, which is only a tip of the iceberg, so to say.
Okay, so this is the question that we want, and we are hoping that this inquiry that the UP government has set up, that this responds to it. Why is it that people had to go to this one quack he's like the mastermind, which the police are now going to investigate into this, that how was he operating? And that's what I ask you, Poonam Mathreja, how is it that this person was operating and he was treating someone for so long, for over 1 year, so we don't even know how many people he's infected?
So, as Pavitra Mohan said, this is a failure of the public health system. There is a shortage of doctors, there is a shortage of nurses, so people go to quacks. People go to quacks and who are not accountable to anybody. Actually, the whole private sector, whether it's a quack or a trained medical professional, There is just no accountability. Our surveillance systems do not exist. They're as good as non-existent. And we have failed our people. The fact that in the days of HIV, AIDS, leave alone other diseases, other infections that can be caused with syringes that are reused, why haven't we told our people? Why haven't we done any behavior change communication? There's huge money spent by government on IEC. How is it that this should be the ABCD in the days of HIV AIDS that we haven't communicated to people? There is just no accountability and nobody cares.
Okay, so you mean that, the young, for example, my colleague was pointing out that it's strange to see that there was a college student who's been infected. Why is it that he wasn't aware? That's what you're talking about as well.
That's right.
Of checking that if he's being used a needle, that it should have been torn in front of him. This basic check would have avoided
But
this.
people don't know it. Neither do we practice such things. There are guidelines for quality assurance. They are flouted or ignored with impunity. That we had 16 sterilization deaths, as you know, where there was, this guy is a quack. I'm not making excuses for him, but we had a doctor in Chhattisgarh who used the same needle to inject 68 or 86 women.
Yeah.
And what happened? He went to jail, he came out. So what does the quack see? What is the models? No, we are talking about a minister resigning. We are talking about a minister being in prison in other countries.
Yeah.
But in India, you can do anything and get away.
Right.
And profit maximization is what the private health system is all about, whether it's a quack or it is a big hospital in India. And that's why when, this whole new insurance scheme has come, many of us have expressed reservations not only on that count, the profit maximization, but we've also said unless we strengthen our public health system, primary healthcare centers, the 150,000 wellness centers that the health ministers talked about, that it is absolute absence of primary healthcare centers as well as sub-centers. And the doctors are missing, the nurses are missing, so people have no choice but to go to the quacks. And second, any public health system, whether it's private or public, unless we make our people more aware, prevention we have not invested in at all, promotive health and preventive health. We really need to educate our people.
I just wanted to go because it's just, look at the shocker of it. I think that is what Dr. Gilada was talking about. We can just get those graphics up. Just look at it. The number of HIV infections due to needles the number has also been rising steadily. Of course, a lot of it could be because of drug usage. That is one of the modes of infection as well. But from 3,518 in 2014 to 15, the last year it went up to 4,011 cases of HIV infections due to needles. These are sourced from the Health and Family Welfare Ministry as well. Politically, Vandana Singh, is this going to be even, we don't even see healthcare becoming that much. I mean, I know because the chief minister's area was Gorakhpur, so the Gorakhpur hospitals, deaths became a huge issue politically across the country. But otherwise, these instances are never really picked up.
The ground reality is there are no hospitals, there are no clinics. If you go to these remote villages, there are barely any doctors out there. You see these RMPs who are practicing for so many years. For them, they are the gods. Where would they go? Even if they want to go, there are no hospitals. So where would you send them? And my concern is, if this can happen in a place like Unnao, which is close to Lucknow, next to Kanpur, what will happen to other places in Uttar Pradesh? Here you have Assembly Speaker who comes from Unnao, from the same, very same constituency where this has happened. Then you have Sakshi Maharaj who makes all kind of statements and he doesn't miss any opportunity to criticize or condemn other political party leaders and political parties. What are they doing about it?
Okay, so I just wanted to first, I just wanted to point out that the bill that was brought in last year for HIV and AIDS prevention, one of the things that it says is that the government will provide treatment as far as possible. Now, isn't that a huge problem, Dr. Gilada? The fact that even
Sunita,
for these people who have now been infected, they're not even going to get retroviral. Yeah.
Yeah, I would like to state 3 important things. One is currently there are very good HIV drugs available, and a person can become undetectable within 6 weeks to 3 months.
Right.
And undetectable is untransmittable. So if somebody is transmitting HIV infection in Unnao, that means that in Unnao those who are HIV infected, they are not treated. That is number 1. Number 2, the recent NACO statistics says that HIV is rising in Uttar Pradesh, Bihar, Rajasthan and Gujarat. And it is lower now in Maharashtra, Karnataka and Tamil Nadu, which was higher earlier. And number 3, that from our side, rather than going into any politics of it, AIDS Society of India with all high quality doctors would like to offer our help to the Uttar Pradesh government in our best possible way. We can go there, investigate with them, we will suggest them certain ways and means how to overcome all these things.
Okay, that's good to hear, Dr. Gilada.
And not only HIV, but we have to look at other infections.
Okay, so I just wanted to ask Dr. Mohan over here, what would you say, what do these people need? If we have any of the policymakers, the ministers, the UP people who are working in this sector, Dr. Mohan, I know you're in Rajasthan, but what do you think? I mean, obviously they need counseling and they need the medicines, but what is the step to perhaps stop the spread of infection? Also to check, how do you go about, I mean, looking at only the people who came to the health camps got detected, right? So how are they going to, what are they going to do over there? What needs to be done?
So I guess that there needs to be an intensive screening immediately set up in the entire area that we are talking of in a short term, in the immediate term, because we do not know, as we heard, that there are more than 1,000 people who still need to be screened. There are only about 100, 200 odd people that are around. So an urgent screening and immediately putting them on treatment is an absolute urgency. And that needs to be followed by setting up a better surveillance system and also looking at, this is only one provider at
how
one place.
Easy is it
detected.
to get how easy is it to get HIV treating medicine?
It should not be difficult. I mean, the national program.
Go ahead, Dr. Mohan.
Yeah, I'm saying that at this age and stage, it should not be difficult for us as a nation to, galvanize.
No, is it accessible in villages at primary healthcare centers? No. Is it accessible? Is what I'm asking.
No, so in primary health center, it is not accessible. Currently, it is the nearest available is at a community health center, which of course is far off. But for this population, it can be mobilized and.
Okay, so that's what needs to be done, right, Poonam Matsreja?
Yeah. Absolutely, we need to mobilize, we need to test, we need to mobilize, and they need counseling not just on the illness. They will have to get counseling on diets. There should be a care center set up in Unnao that.
And the kind of safeguards that they have to take.
Yes, absolutely, and across the country, not just in UP, we have to ban the reuse of any needle. Even one needle in the entire country should not be used, so we have to make people more aware, and there should be serious punishment for people reusing a medicine, a needle, and there should be immediate steps, not just in Unnao, across UP, across the country. And the government must realize that all this costs money. The meager 11.5% budget increase will not prevent such disasters from happening.
Well, we're totally out of time, and perhaps those who are listening, just the arrest of that single person isn't enough. Perhaps they think that they're taking action, but as all our experts have pointed out, they need medicine, they need counselling, and hopefully the government can get in there and tackle the health emergency that is emerging and unfolding in front of our eyes in Unnao right now. Hopefully they are able to tackle that, because it is a serious, serious emergency that is unfolding there. That's it on Reality Check. We'll be back again tomorrow. Join us then.